Hello, Christy. How are you
Hi,
today?
I'm good, thanks.
Good. My name is Andre. I'm a student, nurse practitioner student at Youngstown State University.
Okay.
And I'm just going to be doing an assessment today, just looking over your vessels and then doing an abdominal assessment. Is that okay?
Okay,
All right. Should take about 15 minutes or so, okay?
sounds good.
All right. So her height, weight, vital signs, and pain score have already been completed. It is in the documentation. And scale of 0 to 10, how would you rate your pain today?
Oh, 0.
All right, good. So starting right now, what I'm going to do is I'm going to feel your arteries that you have. So we have your brachial arteries here, and you want to feel together. All right, good. Moving down to the radial arteries, and then the femoral arteries. All right, so your pulses are regular in rate and contour, even in rhythm. They're palpable and symmetrical. They're +2 in amplitude and approximately 60 beats per minute. A 4 would be bounding, a 3 is full, 2 is normal, 1 is diminished, and then a 0 would be absent.
Okay.
So assessing her arms, they are pink, they are warm, the hair is evenly distributed, skin texture is soft and smooth, no evidence of varicosities, muscular atrophy, non-healing ulcers. No tenderness upon palpation from what I could see, and no pitting edema was present. No redness or discrepancies within the skin were noted. Checking her capillary refill. All right, good. They are less than 3 seconds. No evidence of nail changes or abnormalities. And what I'll be doing next is checking your popliteal arteries behind your knees. Good. And then I'll be checking your dorsalis pedis. Good. And then your posterior tibialis. Again, pulses are regular in rhythm and contour, regular in rate. They are palpable, symmetrical, and they are +2 in amplitude, and approximately, again, 60 beats per minute. Assessing her legs, of course, with her gown, she wouldn't have pants on, but they are pink, warm. The hair is evenly distributed. Skin texture is smooth and soft. No evidence of varicosities, muscular atrophy, or non-healing ulcers were noted. And then, of course, no pitting edema in the legs or feet. No redness or any discrepancies with the skin was noted. Also, I'm going to check capillary refill on her toes. Good. Capillary refill is less than 3 seconds, which is normal. No evidence of nail changes or any abnormalities. All right, next I'm going to assess the jugular and carotids. If you could please look to the left, and you want to make sure they don't turn their head too much to the left because it actually can depress it where you're not able to see it. I can see the jugular pulsation. It is just above the suprasternal notch, above the clavicle, right here. No evidence of distension noted. And palpating, you can't palpate the jugular, but I can differentiate between the jugular and carotid pulse waves. What I'm going to do now is I'm just going to measure the jugular venous pressure on the left side. So the head of the bed would be at a 30-degree angle. And having 2 rulers, we would be checking. Let's see here. All right, starting here. All right, and it does look like she is at 4 centimeters, which is normal. Anything less than 9 is good. And then just going to the other side, if you could look to the right for me. All right, and then measuring here. All right, she is also 4 centimeters on that side. All right. So no evidence of distension or JVD. With palpation, I can differentiate between the carotid and jugular pulse waves. And then if you could just look straight ahead, I am going to check your carotid arteries with the bell of my stethoscope. So I'm going to be auscultating for that, listening to any bruise. If you could hold your breath for me. All right, good. All right, good. All right, I did not hear any evidence of bruise. All right, so next what I'm going to do is I'm going to just listen to your bowel sounds, the different areas of your abdomen. Using the bell of my stethoscope, I'm going to listen to the arteries. So I'm going to be listening to your carotids. So right side, good. And then left side, good. And then I'm going to be listening to abdominal aorta. And then renal. And then iliac. It's about 3 centimeters below the belly button. Renal is 3 centimeters above. And then listening to femoral arteries. When listening with the bell, make sure to apply light pressure, since using deeper pressure could turn it into a diaphragm. Next, what I'm going to do is just looking at the general overall appearance. The stomach does appear to be pale with even hair distribution. There is a fine venous network that goes from the head to the feet. From the head, it is above the umbilicus, and towards the feet, it is below the umbilicus. I will be assessing for the aortic pulsation while standing at the patient's feet. And looking, the contour is even and round. It is symmetrical. The umbilicus is midline and inverted. The abdominal surface is smooth and even with respirations. No lesions, rashes, or scars noted. No evidence of any masses, hernias, or separations of muscle. If you could, just take a deep breath for me and then lift your head up. All right, good. And you can go back. Again, no masses, hernias, or separations noted with that. At this point, I will be listening to bowel sounds.
Okay.
So constant bowel sounds are not normal, and an absence of bowel sounds, of course, are not normal either. And then if you don't hear any bowel sounds, you should, of course, listen for a full 5 minutes to adequately, document no bowel sounds present. You want to auscultate before you percuss or palpate, since doing this beforehand can stimulate peristalsis, which can falsely increase or alter bowel sounds, making them different from them at a resting state. So when starting with bowel sounds, you want to start in the right lower quadrant, which is in the small intestine. This is the location that has the most active bowel sounds. And then you're going to go up right above that to the left upper quadrant, or the right upper quadrant. Then you go transverse over to the left upper quadrant, and then go down to the right, listening there. Now, during this assessment, you should also listen to the abdominal aorta, the renal, iliac, and femoral arteries. This was previously done. Bowel sounds were generalized. High-pitched with a gurgly sound. They were about 5 to 30 per minute, which is normal. And then next, what I'm going to do is I'm going to auscultate the liver, which is right under the right rib cage. So listening to that. All right, no evidence of any bruise or friction rubs. And then also listening to the spleen, noting for any bruise or friction rubs, which I do not hear. All right. Are you having any tenderness today in your abdominal region?
No, I'm not.
All right. So this point is the percussion of it. Using your middle finger on the abdomen, I am just going to go down and percuss all the way down. So a dull sound over the liver or other solid or fluid-filled areas, and then resonance over the lung areas or air-filled areas, going through all 9 areas. Now feeling for, we're going to be feeling the percussion of the liver border. So what I'm going to do is you start at the right nipple line and you percuss down till you get to resonance to dull. So here I have reached dull right at this area. You could mark it with tape. And then starting at the lower abdomen, You percuss until you hit dull. So at this point, you would measure looking at the costal margin and the lower liver border, which I will use this to measure. And I had an area here and right here. And it is approximately 7 centimeters, and a normal liver span is 5 to 10 centimeters. Next, we want to percuss the spleen for dullness. You kind of start on that other side, the left side, between the 8th and 11th intercostal spaces behind the left mid-axillary line. You have the patient take a deep breath in, all right, and hold. And then tympany should be heard due to the gastric bubble. If dullness is noted, an enlarged spleen is indicated, and you should expect to hear tympany. So I do hear tympany. Everything does sound normal. There is a round area underneath the left diaphragm that represents gas that is in the fundus of the stomach. Measuring for that, you start at the left midclavicular down until resonance goes to tympany. All right, so at this left epigastric area, it did sound tympanic and slightly lower in pitch. Next thing we want to do is palpation. There is 2 different types. There is light palpation and deep palpation. Light, you use about the fingertips, and you're just going, press about 1 centimeter down, starting at the right lower quadrant. You want to palpate up and then over and then down. You want to do this in all 9 regions from the umbilicus and the epigastric region. Notice that it is smooth and a consistent softness, no bulges, muscular resistance, or masses noted. Looking at the umbilicus, we're just seeing if there is any bulges or masses, and then around with the umbilical ring, also looking to see if any bulges or masses are noted, which they are not. Next, going to deep palpation, you want your hands like this, and you want it 5 to 8 centimeters using deeper pressure, and you will be palpating the liver. So what I'm going to do is with my left hand, I'm going to place it underneath her back, around the 11th or 12th rib, and then palpate deep and into the costal margins. Have them breathe in and out. All right, good. The liver should feel firm and smooth. You can also use a method called the hook method, where you come up to their right shoulder, again breathe in and out. You would kind of hook underneath their rib cage where the liver is, and you can also palpate that way. The liver border is smooth, firm, and even. It is also non-tender. Now checking for the gallbladder. This is also known as Murphy's sign. You would place fingers underneath the liver border, right where the gallbladder would be, and you would take a deep breath. Good. Are you having any pain with that? No. All right, good. So no pain noted. Of course, that would be a negative Murphy sign. Now checking palpation with the spleen. We would reach under the patient's left side of the lateral side, and using your right hand and push in and upward. So reach in underneath, and then you want to push in and upward towards the shoulder. Firmness would indicate splenomegaly. Of course, I do not feel that in this case, so that would be negative. Next, palpating the kidneys. Prior with this patient's history, she does have a history of a left nephrectomy, so of course there will not be a kidney on the left side that I would feel. But here on the right side, you would place hand underneath, and then gently feel for the kidney. Generally, you can feel the right kidney, but the left one you generally do not. Also looking for aortic pulsation, using your thumb and forefinger to palpate. Above the abdomen, slightly left of the midline in the upper abdominal area. It is usually 2.5 to 4 centimeters wide. All right, so that is good. I can feel the aortic pulsation. Next, we will be looking at the appendix. So this is known as McBurney's point. So right anterior superior iliac spine is Murphy's point. To test for this, you would apply steady pressure and then let go quickly to assess if there's any pain with the appendix. So starting here, you would press, let go. You can press and let go. Any pain? No. All right, good. All right, next I will be checking the costovertebral angle for any tenderness. How you would do this is with the patient seated in an upright position. You place your hand directly below where the ribs are, and just with light striking motion, you would ask, do you have any tenderness there?
No.
All right, and that does end this assessment.
Okay.
Do you have any questions?
No, I don't.
All right, thank you.
Thanks.
All right, so a correction to the previous video. You want to make sure that when you're palpating, there's the light and deep palpation. So for light, you just want to use 2 to 3 fingers, going through all 9 regions, checking for any bulges, hernias, masses, any irregularities. And she does appear to have good tone. And then for deep, you want to have your hands on top of each other like this. And this is where you are pressing down about 6 to 8 centimeters. And just doing that, starting at the right and going down the epigastric region, and just doing all 9 regions. Again, checking for masses, bulges, hernias, any irregularities, and then documenting those appropriately.